Still talking health, with the withdrawal of USAID funding, concerns are rising over the future of vaccine availability in Nigeria, especially for children who have never received any form of immunization. In response, the Vaccine Network for Disease Control and its partners have gathered stakeholders in Abuja to validate the partnership to reach zero-dose children PREACH 2.0 strategy, an initiative focused on improving access to life-saving vaccines for zero-dose children. Zainab Akago reports.
While vaccines are critical to child survival, sustainable funding for their distribution remains a major challenge. With the exit of USAID funding, Nigeria's immunization program now faces uncertainty, putting zero-dose children at even greater risk. To tackle this, the Vaccine Network for Disease Control (VNDC) and its partners convened a press conference for the partnership to reach zero-dose children 2.0, an advocacy-based initiative aimed at addressing gaps in immunization coverage and promoting equitable access. Speaking at the event, the Chief Executive Officer of the Vaccine Network for Disease Control (VNDC), Chika Ofo, emphasized the need for timely disbursement of vaccine funding, calling on the federal government to release pending allocated funds.
A sustainable vaccine financing strategy is essential to ensure predictable funding and timely vaccine supply. We plead with the government to release all pending allocation for immunization services in the country and include vaccine financing as a first-line charge in the national budget, ensuring timely disbursement and sustainability. With the exit of the US funding and the diminishing donor support, Nigeria's vaccine financing is more vulnerable than ever. The shrinking physical space, competing national priorities further threaten immunization programs.
Also speaking, Dr. Ibrahim Yaya, chairman of the National Health Insurance Authority, noted that while vaccine transportation is vital, local production of vaccines is even more critical to long-term success.
That we have to produce. COVID has shown us that even during COVID, to get vaccines was a problem. You have your money because there was no aircraft moving anywhere. Ships were down because at the time nothing was moving the whole world, either by air, by road, by sea. So as such, it becomes important that you must produce things for yourself. And I want to say we've produced before. Nigeria used to produce yellow fever vaccines. Even during the smallpox time, we were missing certain elements of the smallpox when they were in the nation at that time. So, given our level of human resources and even technological advancement, we ought to produce vaccines. It will make it cheaper for us, in addition to making it available.
Other speakers at the press conference, including Professor Emmanuel Al-Hassan of the Global Health Advocacy Incubator and Mohammed Usman, former Deputy Chairman, Commissioner on Health Care Services, emphasized the need for timely release of approved funds to support immunization efforts.
We are going to be having really terrible health outcomes. And that is why it is important for government to prioritize this, for government to put vaccine financing as a first-line charge item rather than the current regime where it has to follow the normal budgeting processes.
It's very sad that we are in April 2025 and 2024 vaccines money have not been released. It's really very sad. So what are we saying? Are we really serious? We must, we know that based on the renewed agenda of Mr. President, this issue of timely release of funds for vaccine must be emphasized. He has to do that. He has to show that we must add our voice for the release of that funding.
PREACH 2.0 projects built upon previous interventions and strengthen Nigerians' drive towards achieving universal health coverage. Zainab Akogun, reporting for KAFTAN TV News, Abuja.